Welcome everybody. I'm Sergio Genesini. I'm a surgeon with a particular focus on venous and lymphatic disease management. And I have also the pleasure of being part of a not-for-profit organization called the Venous and Lymphatic World International Network Foundation. A foundation that is dedicated to venous and lymphatic patients, and in particular in these days, to those patients who are contained at home because of the coronavirus outbreak. And so being contained at home, not being able, very probably, to reach out to the elective services dedicated to venous and lymphatic disease management. So the first suggestion we would like to give to these patients and to all the population is to remember that coronavirus indeed has no legs. Which means that if we don't walk it around and if we stay in our houses, there is a significant chance that as soon as possible this pandemic will be over. So please stay at home and be properly informed, following, for example, information like the ones you can find in the link in this page related to World Health Organization, so limiting fake news dissemination. So staying at home, you will have to deal with your venous and lymphatic condition. And so we thought about creating a not-for-profit project called Chronic Onsite Venous Insufficiency Damage Control, which consists in 5 educational videos for the population and in particular for the ones indeed affected by venous and lymphatic drainage impairment. So let's start with the first one in this video lesson that is indeed dedicated to the self-assessment and the awareness related to venous lymphatic disease. It should be a topic of large interest, considering that having venous insufficiency or some sort of lymphatic drainage is like flipping a coin. Indeed, we have more than 50% of the chances of having to deal with that. And the reason for such a high frequency of the condition is easy to be explained. It's basically found in the price we pay in our evolution from quadrupeds to bipeds. Being bipeds, we are overwhelmed by the force of gravity. So there is a higher column of blood that is pushing down toward our limbs. And if you think about that, indeed, we have varicose veins mainly in our lower limbs, not on our arms. And that is because indeed there is a higher pressure exerted in the lower part of the body. Now, physiologically, in a normal condition, the venous blood is flowing toward the heart from the most distal part of the body, pushed and propelled, of course, by the force of the heart push, but mainly also by the muscle masses, as we will see soon in this lecture. Once there is no contraction of this muscle, the blood tends to go down toward the most distal part of the leg. Luckily enough, we have bones that are preventing this reverse flow, so avoiding hypertension in the most distal part of the limb. But if these bones are not functioning properly, or if the vessels is too dilated, well, the blood can go down, pushed by the force of gravity, of course, so creating a dilation and inflammation. The valves then are extremely important in this function of avoiding the precipitation of blood toward the deepest part and the most distal part of the leg. At the same time, it is important to have a proper muscle pump function in the sense that the muscles inside our lower limbs are squeezing the veins, so propelling the blood toward the heart. And as you can see, when the muscles are relaxing, the blood tends to go down, but it is also stopped by the bones, so avoiding dilation and hypertension. Together with the cuff, it is very important to have a good function in the foot pump. Indeed, the foot is like a sac full of venous blood, and this venous blood is propelled and pushed toward the heart every time we put down our foot and we walk. So it is important that in these days of containment at home, in which we are more sedentary, we remember to activate both the foot and the calf pump for proper venous and lymphatic return. Indeed, veins and lymphatics work together and are strictly interconnected and interdependent. In this metaphor, lymphatics are like those little channels we can find in the countryside that eventually drains into the bigger river. In this metaphor, the lymphatics are these small channels, while the river is the vein that eventually ends into the ocean, so the heart, again in this metaphor. The two systems are deeply interconnected, so also the lymphatic drainage can be frequently impaired, so much that the most common impairment of the lymphatic drainage, that is called lymphedema, is also called the hidden epidemic, because so many people, so many of us are affected by this condition without proper diagnosis and proper management. So an hidden epidemic. Just think that 80% of the obese population is presenting some sort of lymphatic drainage impairment, which means that we are talking about 1/3 of the world population at least. At least because, again, it is an underdiagnosed and undertreated condition that usually manifests itself in 4 different stages, starting from subclinical, moving to early fluid accumulation, so some swelling of the limb, evolving toward an edema, that still means swelling, that is independent of leg elevation, which means that even if you elevate your lower limb, this swelling will be there still. And then the 4th stage, that is elephantiasis, which is, as you can see, a clearly evident alteration of the drainage. The turtle over here is reminding us that our population is aging, is becoming slower and slower, meaning more sedentary, and has a tendency to increase the weight in terms of obesity. All conditions that are going to affect negatively the venous and the lymphatic return, so that we will have to deal even more in the next years with this condition, particularly if we go on living in such sedentary way. Looking at the data, you can see that in the last 20 years, for example, the active population with a sedentary lifestyle moved from 15 all the way to 69%. So remember, in these days of containment at home, don't be too sedentary. Activate your muscle pump. Of course, stay at home. This is mandatory. But at the same time, remember that staying at home doesn't mean staying passive. Stay active and activate your venous and lymphatic circulation. Also because otherwise you get the risk of climbing a quite dangerous stair. What you can see over here is the examination you can have, opening your eyes and looking at your limbs. The first manifestation of venous insufficiency is the presence of spider veins, inesthetism associated with reddish or bluish vessels that are pretty frequent in the population, up to 80% of us. This doesn't mean pathology. This means a sign of course, venous hypertension, but that shouldn't worry us so much per se. The second step is varicose veins, so dilated vessels along the leg, tortuous veins. If these tortuous veins are associated also with the swelling, then we are already at the 3rd step of these stairs. The 4th one is very important because we are getting into a severe condition that is characterized by the filtration of iron outside the venous circulation. And indeed, you can notice the typical brownish color associated with iron deposits. This is leading to a severe inflammation that will lead to the opening of real holes inside your limb. That is, in terms of impact on the quality of life, a significant damage. It has been compared even with chemotherapy in terms of quality of life impairment. So please avoid to reach these severe stages, because once you arrive to the fifth step, it's not possible to go down anymore. So not only look at your lung, but also listen to your symptoms. All these symptoms are usually potentially associated with venous and or lymphatic impairment, pain, venous cramps, throbbing, tightness, heaviness, fatigue, feeling of swelling, itching, the impossibility of keeping your legs still during the night, for example, when you're lying down, some tingling sensation, hit or burning, and at the same time also the possible general ill-being. Now, all these symptoms are not specific for venous symptoms, but they can be present in venous insufficiency condition. But symptoms could also be absent, and still you could have varicose veins, which means that you still have to take into consideration possible evolution of the condition, so being properly informed. And these are data coming from an interesting study done in Edinburgh. Another thing you can do is touching your limb. If you feel that there is a warm area, that could be a severe inflammation associated with an alteration of venous return. At the same time, you could identify a dent where you pushed with your finger, so indicating that there is an accumulation of fluid that is not normal. And also remember that if you see vessels like these ones, not always is a problem limited to the lower limb. It could be a problem coming from the upper floor, from the abdomen. You might be familiar with the male varicocele, but there is also a female varicocele that is a reflex coming from the veins inside the abdomen, and in particular the ones associated with the ovaries in the females. Now, this is extremely frequent in reality, and it is responsible for an amount of cases that is superior to asthma and back pain. So you understand how frequent it can be. We're talking about 10% of all gynecological referrals. So a condition that is associated with a venous alteration inside the abdomen, for which, if you suffer of constipation, you should fight that. If you're used to have weightlifting or too many amps when you are doing exercises, you should be aware of this, because whatever condition increasing the pressure inside the abdomen will make this pelvic venous disorder, as it is called, worse. I'd like to point out that whatever you are listening in these educational initiatives, whatever recommendation, whatever suggestion, cannot substitute your general practitioner and your specialist consult and proper recommendation related to your specific case. So again, this is just an educational material that cannot substitute your general practitioner and your specialist evaluation. While you're waiting for meeting your general practitioner and your specialist in veins and lymphatics, you can prepare yourself with some educational tools we can find in this page, thewinfoundation.com/education. It is in several languages. It is a questionnaire with true or false possibilities. Once you flank true or false, you will have the pop-up of the article, the scientific evidence-based data showing you why it is true or false, both for lower limb chronic venous disease and also for the abdominal condition of the pelvic venous disorder. For the health professionals, in the same page, it is possible to enjoy free open access educational videos dedicated to the different topics of the venous and lymphatic condition. And I like to say goodbye to you before the next educational video together with Professor Caprini, a leading figure in our field. He has taught us that we should never treat a stranger so that we would never kill a friend. And the meaning of this sentence is that we should know really well our patient in terms of the risk factors, his history, so that we avoid to underestimate the risk of having to deal with venous thrombosis, a topic, again, that we will deal with in the next educational video, and that is considered a leading cause of preventable death, so extremely important. On behalf of the Venous Lymphatic Ward International Network Foundation, I deeply thank you for the attention to this educational video. I also beg you to take extreme care in fighting fake news in these days, in particular on COVID, but at the same time also on venous and lymphatics. This is a topic we will develop during the expo in Dubai. But at the same time, I like to invite you, even before Dubai, to be part of this teamwork that is open to both health professionals and non-health professionals, since at this page you can indeed report eventually encountered fake news in the venous lymphatic field, or informations of which you are not so sure and that you would like to have a confirmation of by means of a consultation, of course for free, from the scientific committee of the Viewing Foundation. I thank you again for your attention, and I wish you safe days and proper containment. Thank you.